Good morning, ladies and gentlemen. It is such a great honor to welcome you to this update on COVID-19 with KAM leadership and from fellow executive drawn from Kenya Health Federation and National COVID-19 Vaccine Deployment and Vaccination Task Force. I'll be your moderator, and my name is Joe Bonjohi, Head of Policy, Research and Advocacy at Kenya Association of Manufacturers. COVID-19 pandemic has turned tables on the manufacturing sector, and current statistics are running from bad to worse every day. We are right in the middle of third wave as a country. To bring this into perspective, the positivity rate has increased from 2% in January 2021 to astonishing 20% and above as we hold this update today. Meaning for every 100 Kenyans tested, 20 will turn out positive. This called for review of containment measures by His Excellency the President through Public Order number 2 of 2021 on coronavirus pandemic. The order comes with economic sacrifices and insecurities with sole aim of regaining health security as a country. Gains are playing maze game with losses. The order affects manufacturing lives directly from cessation of movement, vacation of curfew passes and exemptions, a review of curfew hours, closure of education system in 6 counties, bars, restaurants, eateries are also closed partially. To help fight manufacturing resilience and continuity, we have a panel of KAM leadership and medical experts to unpack the public order and chart clear path for the manufacturing sector. Let me take this opportunity to recognize guests present, Mr. Mushai Kunyiha, who is KAM board chair, Madam Phyllis Wakiaga, who is KAM Chief Executive, Dr. Richard Aya, a member of National COVID-19 Vaccine Deployment and Vaccination Task Force, and Senior Lecturer, School of Public Health and Director of Science at Technology Park, University of Nairobi, and also Dr. Anastasia Nyalita from Kenya Health Federation, who is the Chief Executive, and also KAM members here present. For the smooth running of the program, let's observe the following. Please mute when you're not speaking. Feel free to share questions to our speakers through the Q&A and comment sections. We shall have a Q&A session, and what we are requesting you to do is please indicate the name of the speaker that you're directing the question to, so that these questions can be answered on the run or as we run the program. So at this point, I want to welcome Madam Phyllis Wakiaga to give her opening remarks.
Thank you very much, Job. Good morning, everyone, all our members who have joined this morning. I hope that you're all keeping well. Allow me to welcome the panelists who are here with me today. We have the Kenya Association of Manufacturers Chairman, Mr. Mushai Kunyiha. We also have Dr. Richard Aya, who is a member of the National COVID-19 Vaccine Deployment and Vaccination Task Force. He's also a Senior Lecturer, School of Public Health and Director, Science and Technology Park at University of Nairobi. I also want to welcome Dr. Anastasia Nyalita, who is the Kenya Health Care Federation CEO. All the KAM members who have joined us this morning, ladies and gentlemen, good morning. It's a pleasure to welcome you today to this virtual event that we are holding. As Job has mentioned, we are facing the third wave of the COVID-19 pandemic, as we have witnessed by the ever-increasing number of positive cases in the last few weeks. And we were gearing up to the rebound of the economy and the growth of the manufacturing sector, having started the year with the economy being reopened and schools and other activities continuing. But the third wave has thrown a curveball in our plans for the year for 2021. However, we also recognize that economic recovery can only be achieved by overcoming this health crisis that we face. And this is why we continue to call on all of us to adhere to the measures and protocols that have been put in place to mitigate the spread of the virus. So for today's session, we are here to give our members an update on the pandemic in the country. We also want to unpack our initiatives and those of government that are geared towards ensuring business continuity and sustainability, even as we operate in this tumultuous environment. We have great speakers, and I know we are going to learn a lot from all of them. So we welcome you all, and we look forward to having a very engaging session, and we will be able to at least address some of the concerns we have been receiving on email, on phone calls from our members. So karibuni sana, and God bless you all.
Thank you, Phyllis, for your insights and also for welcoming us to this session. And also noting that we will be looking into the policy and operational issues that are coming with the containing measures. We're looking at ensuring that the manufacturing sector will remain resilient and sustainable, even at this time that we are facing the third wave. Let us welcome Mr. Mushai Konyiha, who is a KAM board chair, to also make his remarks.
Okay, thank you very much, Job. And I want to give a special welcome to everybody who's on the call today. We have the two doctors who are going to be speaking to us a little bit about where we are on the disease and vaccination, especially as a way out. Special welcome to our directors and other leaders, sector leaders, and chapter leaders who are on the call. Thank you very much for joining us. It should be also good to especially mention the KAM COVID-19 Response Committee. We have a committee of the board that meets to look at the issues around COVID, and it was actually on their suggestion or the initiation that this meeting came, as we've got another lockdown, to have a discussion with our membership, just to update where we are, what the issues are, and what we are going to be doing. Plus also for the question and answer, to hear from you the issues that are arising and that we may need to address. Like Job mentioned, and I think we've seen everywhere in the press and the conversations we've had, we are definitely not in a good place as a country as far as the spread of COVID-19 goes. Not only are beds scarce, we are losing a lot more people, and the increase is actually growing much faster. I think one of the things we sometimes find difficult to understand is that the disease grows exponentially, not linearly. So in a couple of days, the multiplication can become pretty huge. We know even the doctors, the Kenya Medical Practitioners, Pharmacists and Dentists Union had already raised the alarm last year, as did the KEPSA, around the issues around it. I think it's good for us to remember from the lessons of last year around COVID that really there is always a balance between lives and livelihoods, and that fundamentally COVID-19 is a health crisis, but it then has secondary effects. But the key thing probably we learned from also other countries in the world, as we are seeing, is that if you don't deal with the disease itself and the disease spread, you're going to have bigger problems with livelihoods and the economy. So we have pain, that's for sure. I think whatever constraints we have are always painful. But that was going to happen. Once the disease was out, pain is going to be there. So the idea that we should be looking at is how do we minimize the pain and the losses around that. Obviously, we know we have continued to lose not just Kenyans, but also members of the manufacturing fraternity. So we, I'm sure all know people, and both industrialists, people working in our businesses and their families who've been affected, and we send our condolences to them. So as we struggle with this, I think government has put in some changes, and we are going to need to adapt to them as they are coming. KAM was part of the conversation with KEPSA, asking government for some restrictions. I think the restrictions we got were way more than we had requested, so it was a little bit harsher than we thought was going to be done. But that is what we have at the moment. So we are asking our members to adhere to the new requirements, because we need to, at the minimum, reduce the spread of the disease. We've seen all these, the positivity rates, the number of patients we are getting. That number has to go down for us to result to some kind of normalcy. One of the things we noted, though, is as we got into the new restrictions, what was missing also was some kind of, cushioning or rebate from government, something to keep life a bit easier, even as things got tougher due to these health measures like we had last year. We had some good tax incentives that they were not, they don't solve the problems, but they cushion the shock. And this time we've not had any. So we are actually trying to advocate for some measures that would be able to help businesses to get through these difficult times. Actually, what has happened in between, taxes have risen. We can see what is happening on fuel. We've seen minimum taxes coming into play. And we are saying excise also went up. We're saying maybe we need some rebates around those things just to keep businesses going. We have the benefit of the work that's been done by the Secretariat and also what we did last year to help at least movement continue. And that was one of the key things, trying to clarify the rules around workplaces and what can continue around manufacturing. Thankfully, the government is keen to make sure manufacturing continues, that we keep Kenya moving, as we said last year. So we are still going to work within the new conditions. We have restrictions, yes, but we are more or less back to what we did last year. And we've been engaging with the command center, the COVID-19 command center, to clarify those rules. We yesterday got the confirmation around movement and passes. So we hope that we will be, and all our members, we're asking them to follow those rules around the movement and the forms that you need to fill in. We'll be reviewing and updating the list of the providers. I think there are some requirements the command center has asked us to do in the coming weeks, and we'll be discussing those with you as we go along. But for now, we can use the existing passes that we have. So we're asking you that you make sure your drivers have the stickers and the lecters that they need. I think it's a Form 1 that they need to be able to move across. We've opened again the help desk and the member support, so that if you do need new passes or to engage with the Secretariat on that, please go through the help desk and you'll be able to support you that way to get new passes and so on. Of course, this maybe did not come at a good time, and probably by January and December, we were beginning to think Corona was over and so on. But perhaps it's taking us back to our conversations of last year around resilience. We're going to have to be able to adjust our businesses to shifting sands. And the resilience is that these cycles may continue in the future because Corona is not yet gone. So we need to structure our businesses and be prepared for these kind of changes so that we can adjust when the time comes. So it's about your ability to adjust and fit into the new circumstances. That is going to be an important part of our survival in the coming weeks. Of course, the big issue is also going to be around vaccination. And we have been really pushing as an association that we try and get more vaccination done. So we've been also there engaging as a private sector consortium with the Kenya Health Federation and with KEPSA, saying how can we get more vaccines out. There is, of course, an issue around supply of vaccines. globally. That's not just in Kenya, but we think that will probably be temporary, because as time rolls on, there is more and more capacity coming on board, and we should be able to get vaccines in the system. But our system, to make sure we get more and more people vaccinated, will be useful. That is our best way at the moment out of this whole COVID cycle, so that we can avoid these cycles of lockdowns. There is, of course, also encouraging government to improve health facilities, so that if we have more capacity in the health sector, we'll be able to continue working even as the virus is around. So we encourage you, if you have the opportunity, get the vaccine. And we are trying to make sure that we can arrange something for manufacturers to be able to access the vaccine quicker or easier. It will not just be for manufacturers, it will be across all the sectors, it will be for the whole country. So basically, we are trying to make sure government, we say, please do no harm. Let's try and limit the new measures that we are putting in so that people can keep operating. Give us some cushions, because we are not out of the woods. And encourage more vaccination, as well as taking the measures that are needed to avoid the spread of the disease. So we are looking forward to hearing your questions as well, and also hearing from the two doctors this morning as we engage on this. So that's all I had, and we'll be answering your questions later. Thanks, Joe.
Thank you so much, Chair, for your remarks. Well appreciated. You have rightly noted that the social and economic fabric of the country is being ravaged by this unseen enemy, which is quite present with us, and we need to take the right measures. Also, we have appreciated your remark as far as the tax incentives or the policy incentives are concerned. We would like to see a resumption of what was taken away by the government in December, so that the manufacturing sector and the private sector in general can remain resilient and afloat despite the challenges and the unseen enemy that we face today. Also, you have noted that we have to ensure that the manufacturing sector is very strong, because it is the one that has been supportive of the economy for the last 13 months, as evidenced with the innovation, the repurposing of the manufacturing sector to ensure that the country is surviving and the manufacturing sector is surviving. Thank you so much. At this point, I want to invite Dr. Anastasia Nyalita, who is the Chief Executive of Kenya Health Federation, to share her insights. She has held various board positions, including past president for Kenya Association of Pharmaceutical Industry and past council member for International Federation of Pharmaceutical Manufacturers and Association. Dr. Nyalita has held various senior leadership roles in policy and advocacy, business and technical operations in several health organizations, and multinationals in the pharmaceutical and consumer health sectors over the last 20 years. She has a geographical experience across sub-Saharan Africa and Southeast Asia countries. These roles allowed her skills and experience in leadership, external affairs, business management, project planning and execution, as well as strong organization skill. Dr. Nyalita, most welcome. The floor is yours.
Job, if you can allow me to share the screen. Okay, good. Good morning, everyone. Nice to be here, and it's a pleasure to speak to the private sector manufacturers. Of course, I have an history in local manufacturing when I was starting off in my career as a pharmacist. So I worked, and I was also a member of the local pharmaceutical manufacturers, of course, by extension, Kenya Association of Manufacturers. For today, what I would like to share briefly is, and tell me when you can, sorry, just 1 minute. Yeah, I want to share our perspective as Kenya Healthcare Federation on, this COVID response and what it means to us. And in particular, I know we are not sure whether or not to take the vaccine. I will give you the private sector perspective. Dr. Aya will give you the government perspective. But what I can assure you is that we are working very closely with the Ministry of Health, with KEPSA, just to champion the private sector perspective and needs of the private sector, and not only as a health sector federation, but also, representing the broader health sector, private sector. So just to tell you a little bit about who we are, so Kenya Healthcare Federation is the health sector board of Kenya Private Sector Alliance. We were founded in 2004, and this was primarily driven by, if you remember, for those of you who remember the Ngilu bill on national social health insurance, which was going to be a little bit more, or it was going to be punitive to the employer. And hence, we came together as a private sector health board to champion the aspect of perspective and lobby for the private sector perspective on that. And sure enough, we were able to be successful. Eventually, after a couple of years, 2008, we were registered as a company limited by guarantee, and we've been operational since then. In terms of our membership, basically our membership is drawn from all the health subsectors, whether it's healthcare financing, supply chain, service delivery, human resources for health, and so on and so forth, and advocacy as well. And we have a membership of about 170, and they are drawn from either health or corporates, NGOs, social enterprises, or professional associations in health, or trade associations. And like your FKPM is a member of the Kenya Healthcare Federation, the medical insurance providers, and so on and so forth, hospital associations as well. So basically for us, we're looking at the entire ecosystem of health as far as private sector is concerned. So in terms of, and we're structured in such a way that, our members do participate in those committees that they feel, they can offer technical expertise, and also, they can have their issues addressed. We do not limit in how many committees that the members can participate in. And this is from the committees that we get the issues that will need to be lobbied, either at the Ministry of Health, and if it's a cross-cutting perspective, then through KEPSA, these are taken to the other, other ministries, or essentially at the end of the day to the presidential roundtables. Now, in terms of COVID response, just this structural representation of how we've been operating since last year. Basically, we have a very active COVID response team that interlinks with the Kenya Private Sector Alliance COVID response team, and the Ministry of Health COVID-19 task force, which also we're very active in. And of course, directly we have what we call the ministerial stakeholder forums, and also we do direct advocacy and lobbying and linkages with the senior senior government officials, either the CS level or at the chief administrative level, or even at the task force level. So just to show you an idea of how we are structured. But I want to talk about, the COVID vaccine, and in particular, nail it down to the vaccination, because I know that is what is in everybody's mind. Where the chair has mentioned about, and Phyllis as well as mentioned about, the wave. Job has alluded to this as well, and we all know what's happening. And we have to just ride the wave, and we have to ride it responsibly and taking all the necessary measures. And luckily, we have the vaccine with us. Just in terms of death rates, so, which group is has the highest death rate. And you can see, of course, like has mentioned, and that informed the inclusion of people aged 58 years and above into the current phase 1 of the vaccination. So you can see how the process, how the landscape looks like. And of course, with age then comes, underlying conditions, etc., and potentially that is why. Now, I know everyone, you've seen a lot of information and misinformation, and most of the information that is on the internet, really you cannot rely on it. And I would urge each one of us, if you really want to have unbiased information, go to the Ministry of Health website, but also visit the WHO website. They have a lot of information that is factual about vaccination and also COVID response in general. So by being vaccinated, it protects you against the disease. Yeah, so it's an immune booster, just like any other vaccine. That doesn't mean that you cannot catch the virus, but if you do, then it protects you from the disease from progressing to severe version or even death. So it is very important that we get vaccination. Then through the vaccination, there is a reduced risk of developing the illness and its consequences, as I mentioned. It also helps us fight the virus if exposed. And then it also helps us protect the people around us, because if we are protected from getting infected from the disease, then you are less likely to infect someone else. And this is this is what informs also the mantra that no one is safe until everyone is safe, and the push towards getting as many people vaccinated as quickly as possible. Of course, we know there are limitations, and we have to work with what we have, and probably potentially not. And the reason behind the phasing of vaccination. So it is also particular. This particular important. It is also important to protect those at risk for severe diseases. Those with underlying conditions, older, the elderly, the healthcare providers, because they are. They're very high risk, because they are confined in these places where we will probably, where the virus, people who are sick are coming in, and essentially if you stay in an environment that has, that is contaminated with the virus, you're highly likely to get, the viral infection and at a higher dose of viruses. So that's the reason why we're looking at the, healthcare workers. Now, because I know, we've been asked as a healthcare federation, everyone is coming to us and tells us, how can we get on board? Because also, our people are exposed. We have cashiers in the supermarkets, we have, different people. Everybody, of course, has a justification, but of course, from a scientific perspective, then, the priority has to be looked at. And essentially, of course, as I said, the reason why the 58 plus have been brought as fast-tracked. Now, which vaccines are available? I know, again, you've seen a lot of information out there. And one of the things I'd like to mention is that because of the nature of the fast tracking of vaccine development, then, of course, the vaccines are being given what we call the emergency use authorization. And there are very many vaccines that are in the pipeline. So just to make sure that, to reduce or to really make sure that, the risk benefit is closely monitored by the regulatory authorities and the WHO. So they have a process, and this is not new, by the way. This is a process that is used even for other products. It's also used for other vaccines that have been developed in the past. It's just that in public health interest, these vaccines have been brought to the market before now the entire chain of clinical trials has been established, so that we protect as many lives as possible. So we have a number of vaccines in development. We have those that have gotten WHO listing, emergency use listing or pre-qualification. And basically what that does to the developing countries, because is to just reassure them that, look, this product has been checked, benefits outweigh the risks, you can use it. And that helps the developing countries or the underdeveloped countries, and they have systems in place to ensure the fast tracking of the approval. So if you have WHO approved or listed product, including a vaccine, when it comes to Kenya, the manufacturer will apply together with the local technical representative and gets, and if everything is in place, if all the paperwork is in place, then it only takes 7 days. If you don't have a WHO listing, and you can see from this chart, some do have, some don't have, then the evaluation process is longer, not more than 30 days. So, and the reason why for Kenya, for example, we have AstraZeneca from Serum Institute and from SK Bio, it's already approved. We have Sputnik is already approving Kenya using the necessary approvals. Some of the other products, like the one for Johnson & Johnson and others, are in the pipeline. They've to apply to WHO, and also once we have WHO authorization, then they can apply for approval to the Kenya Pharmacy and Poison board to get the necessary approval. So just this is a list, and this is available in the WHO website. So you can go in there and get updated on what is approved on a regular basis, and just a few that are in the process. So just that's for your information. So from a private sector perspective, I think one of the things that has come out, and I think it is something that we should be also proud of as a country, is the fact that we have a guidance on the role of private sector in the development of COVID-19 vaccines. You know, if you want, so, and this actually says now, because the current vaccine, Covishield, is, you know, it's brought in through the Covishield facility, which means, or COVAX facility, which means, you know, you can only draw so much as a country, and you know, there are limited supplies. If private sector wants to go and import the product themselves, there's a prescribed process through which they can import. And this is a process that the one from Russia has used. And, you know, in this private sector, of course, it means, you know, the commercial model, business model is different from, you know, the one available by the government free of charge. And this is purely to supplement. Now, not many manufacturers will be willing to you know, to ship directly to the private sector in the countries, but we expect this to improve with time. And as it improves, then we have more supply and availability in the private sector. But for the moment, it is very recommended that, you know, for those of you who qualify according to the criteria, please make yourselves available and get the vaccination at either the prescribed health facility, either it's public or private sector. Now, this is what has been shared with us by the Ministry of Health. Just to give you the numbers, I think I would leave this to Dr. Aya to just drill into it, but basically these are information that has been shared with private sector with now interactions. It was also a presentation that was given to the private sector leaders through KEPSA, but basically what the plan is for Kenya and how it is, you know, who is supporting the process. So vaccinate 30% by June 2023 in 3 phases. You know, Gavi is providing 20%.
I don't know whether it's my system that has a problem, but we might have lost Dr.
Yes, I
Nastasia.
think we have. I also thought it was my end.
Yes.
Let me try and reach out. Anastasia, can you hear us?
I think we have lost her completely, because I can see her even on my screen. So what I would suggest is that we can go on with the program. Once she rejoins, we'll give her the chance to finalize on the presentation. So at this point, at least she had noted that age is something major to consider when we are rolling out the vaccine, or even when we are deploying and implementing the anti-COVID measures. Also, we have seen the list of vaccines that have been approved within the country. It's a question of how much, or the quantity that we have in the country, what we are expecting of this vaccine, so that we can vaccinate as many persons in the country as possible. At this juncture, we are pleased to invite.
Back in, and Dr.
Anastasia
is back in.
Oh yeah, she's back.
Yeah, my apologies. I was just about to finish, nevertheless. I'm not sure where I lost you guys, but sorry about that. Let me just read off from the screen without screen sharing, just to make sure that I don't lose you guys again. But basically, so I was talking about the 3 phases. I think Dr. Aya can probably, you know, provide details on that. But, you know, this is based on the information also that has been shared with us as private sector. Yeah, think in the terms of the phased approach, there is provision for private sector health facilities, and that's a great thing for us, and it's something that we must take care of. What I wanted to conclude with is what every one of us can do. We must continue to observe the IPC protocols, social distancing, strict hand hygiene, respiratory etiquette, appropriate use of face masks in areas where physical distancing is not possible. This is very critical because it has to cover both the nose and the mouth. And if you can in your establishments really enforce this, it will go a long way in mitigating the response aspects of COVID-19. So please, it's not insist on your employees really using the right mask and putting it on correctly. The mouth and the nose. Most of them only tend to cover the nose. And then in the event that you have anyone that is not well, let them stay at home. They can work from home, because then in the event that is a COVID-19, you also reduce the risk of infection. So with that, I'd like to thank you very much, and I welcome questions. Thank you.
Thank you, Dr. Anastasia Nyalita, and also for managing the system back. Thank you also for encouraging us to observe the protocol and the guidelines that have been provided, because it is a question of personal responsibility to protect ourselves against this pandemic. The government cannot be able to police us, even in our small cells. So let's ensure that we are keeping to the protocols and guidelines as much as possible. At this juncture, we are pleased to invite Dr. Richard Aya, a member of National COVID-19 Vaccine Deployment and Vaccination Task Force, a senior lecturer, School of Public Health, and Director of Science at Technology Park in the University of Nairobi, to speak to us. He's a medical doctor with over 25 years experience in health system and health policy development. Dr. Aya also serves as the chair of Center for Health Solutions and Global Programs Kenya, University of California, San Francisco. He is a consultant for Ministry of Health, UNICEF, WHO, UNFPA, and AMREF. An interesting fact, Dr. Aya is also an author, having written 3 books and has published many scientific journal articles, policy briefs, conference presentation, and newspaper articles. The floor is yours, Dr. Aya.
Thank you very much for that introduction. Now, I thought I'd just take a few minutes and talk about what we're doing in the vaccine task force. So just one correction from what Dr. Nyalita said. I'm not representing government. Okay, so I'm just a member of the task force. Okay. And I'm based at the University of Nairobi. So I'm going to sort of mix. So don't take anything that I say to be the official government position. There's the chair of the National Vaccine Deployment Task Force, Dr. Willis Akwale, who is better positioned to speak on behalf of the task force. And then, of course, there's every week, I think on Wednesdays, there's a press briefing, particularly on the vaccine deployment. So I thought just in starting, I'd give a quick overview of what the vaccine is supposed to be doing, and then talk a little bit about how we plan for the vaccine and where we are in terms of implementation. And then I know there are lots of questions. A lot of the questions tend to be about the vaccine and whether it works for particular individuals, but I think I'll talk a little bit about what role the vaccine plays in terms of the health system. So one of the things I think we always have to remember when we're discussing the deployment of the vaccine is the kind of health system that we have. Now, we have a health system that is in 2 parts in terms of thinking about it. So we have the private sector and then we have the public sector. Overall, the public sector provides about 90% of care, and the private sector provides about 10% of care. But in terms of financing, the private sector takes about half, about 50% of the financing, and the public sector gets about 50%. And overall, we are underfunded. So the underfunding is in total, and then specifically when you come to public sector, there's underfunding because there's a big shift to the private sector. So that's just the reality of it. So whenever we talk about a weak health system, these are some of the structural issues that exist whenever something, whenever we try to do something. So the next thing is that why we have all these COVID measures, it's because at one level, we want to prevent the collapse of the health system. Now, the collapse potentially is at two levels. One is financial. So the health sector in terms of contribution to the economy is somewhere in the region of between 7 and 10%. So it's a significant player in terms of our overall economy, just in terms of inputs and so on. In fact, in many sub-counties, the hospital is going to be the largest enterprise that exists in terms of, if you think about the hotel side of it, the food they order, the drugs, the equipment and so on, it's a significant part of the economy in terms of employment and so on. And then the other side of it is that, of course, we need good health to be able to manage everything else. So if the health sector is not functioning, particularly the curative side and also the public health side, then people are ill unnecessarily and or they can't be treated, and that then affects everyone else. So there are those two levels that we don't want to. We want to do as much as we can to ensure that the health sector is functional. So that's why we go into all these public health measures. Now, we're all aware at this point in time in terms of how the COVID has evolved, the coronavirus and all that. I think we always have to take a step back and realize that we're in a 1 in a 100-year event. I was telling my son the other day that this is something he's going to be telling his grandchildren, not even his children, about. So even though we talk about this sort of from week to week, oh, we're in another lockdown, 30 days, I think there's a point where we have to take up a step back and realize that this does not happen too often. And it's unlikely that, well, hopefully, that it will happen again in our lifetime. So the measures that we're taking are, some of it is just to survive, but some of it has long-term implications. And I'll give you one little anecdote. All the schools of public health started after the last pandemic in 1918, 1920. Before that, we just had medical schools, and public health was something, a small subject that was tucked in under medicine. But after that is when, particularly the Rockefeller Foundation started funding schools of public health. So all the major schools of public health were funded by Rockefeller, from the Harvard, the London School of Hygiene, and so on. So that is what arose out of that. So in a sense, we're benefiting from that last pandemic. Moving closer, in terms of the vaccine, there's the technical bit, which I think there are people who are really expert in terms of explaining it. My side of it, I'm a health systems person, though a medical doctor, is this. The vaccine does two things. One is that it prevents severe disease. And secondly, once you get the second dose, it prevents some of the transmission. However, it's part of a package. So if you think about what is being advocated for physical distancing, for example, the vaccine can't jump. So as long as you're far away from the next person, that's it. The vaccine just can't jump. Then you have, so in terms of efficacy, effectiveness of physical distancing, you're talking about 90 to almost 100% in terms of the spread of the transmission. Then you have masks, and masks, worn properly, have the effectiveness of about 80 to 90%. And then the vaccine, after the second dose, also has efficacy of around 90%, whichever vaccine you're looking at, between 70 and 90%. So if you combine those three things, then you've got fairly effective measures to prevent the spread of the vaccine. But the most effective are the first two, or the easiest, not easiest in that sense, but you can see what I'm getting at, that we need to have all three of them in place. So the vaccine is the new kid on the block, but the first two also provide a lot of coverage. Now, the task force the National Task Force was formed by the Ministry of Health. It's under the leadership of Dr. Willis Akwali, an experienced public health practitioner. It has 7 subcommittees that are looking at each aspect of the vaccine deployment. The vaccine that we're dealing with, so the plan is about vaccination. And then we have the issue of which vaccine. Now, currently the 2 mechanisms that exist, one of them is to buy the vaccine. And there's a big issue about that. So the plan has a small element of government buying vaccine when it's available. And then the second one is the COVAX, which is an initiative under the regular immunization program to try and procure vaccine for countries that are not able to get. And you realize there's a big scramble to basically corral all the available vaccine. And part of it is it's turning into a kind of a trade war in a way. So the Americans are there with their Pfizer, the British are there with AstraZeneca, the Europeans are somewhere in between. There's Johnson & Johnson, and a lot of them, depending on where the plants for production are, have bought up all the stock that's available over the next 2 or 3 years. Now, they're doing that for 2 reasons. One is that a lot of the countries in the West, the developed countries, have a large proportion of elderly population. Now, we are lucky, in quotes, in that we only have about 2.5 million out of our almost 50 million population that is above 65. And the other thing is that a lot of our elderly do not live in congregate settings. They don't live in nursing homes and so on. They tend to live in the rural areas. So they kind of spread out, which is both good and bad. But in this particular case, it's a little bit of an advantage that we do not have a large population that is very vulnerable. There's the elderly. The other part of the population that is vulnerable, those who have pre-existing conditions, there are various estimates. Now, we don't, when you talk about a weak health system, one of the problems we have is that we don't have very good data about how many people have diabetes or hypertension and so on. We have various surveys done, but it's difficult to put an absolute figure. So the estimate is between 4 or 5 million people will have these conditions. So when we get to the target that is being talked about, the 30%, you realize that half our population is under 18. So 50% of the population at the moment really do not suffer from coronavirus. They don't get COVID disease and they don't get severe disease. So we're fairly safe. So we're talking about the other 50% who are above 18. So in that sense, the 30% target is not too bad a target to aim for over the next 2 or 3 years. Now, already Dr. Nyalita mentioned about who was supposed to get. So the plan has been phased so that in phase 1, we looked at those who are most at risk. That is health workers, the uniformed forces, and other frontline people. And these are people who basically in their day-to-day work encounter a lot of other people, particularly the health workers, because working in a health setting, there's a lot of disease around by definition. So they're fairly high risk of getting it and also of spreading it. So that's what was thought about in terms of phase 1. And then the next bit was to look at those who are most vulnerable. If they were to get the disease, they're the ones who would end up in dependency units and in ICUs and so on. Those would require the most care. And here we have a big problem as well in that financing COVID as a new disease has been really problematic. There really isn't a clear policy about how to finance it. So all the insurance companies jumped and said, we won't finance. Government itself, NHIF said we won't finance. So it's up to households to finance. And they're financing at 2 levels, the curative, and there's also this huge bill that keeps on going up in terms of testing. So for me, whenever I see that figure of numbers tested, you multiply by roughly 10,000 bob, you get a figure which is quite astronomical. Right now, it's something between 5 and 10% of our total health budget is going just to testing. It's not sustainable. So we have to figure out how to do something about that, because we're diverting money away from what we would consider to be our regular programs. So that for me is the context within which the vaccine program comes in. So I've mentioned that we have the phases in terms of deployment. Initially, what we did when we started by training, TOT, training of trainers, to look at the level 4, 5, 6 facilities, which are about just over 600, to start the vaccination program. The reason for that was this. Number one, as has been mentioned, we have a new product, a vaccine, which is still in emergency authorization, which simply means that it's not been, it's safe, but not been adequately tested and is not available for sale. Therefore, we wanted to start it off with those facilities that have capacity to provide the vaccine without affecting their regular programs. So when you go lower down, the next level of facilities, which are about 8,000 to 9,000, the health centers, usually there's only one vaccinator, a nurse. And therefore, if you have this vaccine coming in as well, they will stop doing their regular vaccination, and that will affect our health probably even more than the COVID. So this is balance between making sure that the existing programs continue, particularly vaccination, and we add this one. So it's for members to realize that this is added on to the regular programs. We must continue doing the regular vaccination. So we started off with those, training those 600. We did the first TOT. Right now, we're doing the second round of TOT training. This is being done grouped around the 8 regional depots. So a second county training. And this should complete the 650 or so health facilities that were to be done under phase 1 and also to help with phase 2. So by next week, this should be complete. Now, we received 1,125,000 doses. These are the AstraZeneca ones. And then also recently, Sputnik also imported some. The other thing that was a big issue was where the data was going to be. Now, under the regular immunization program, it's all paper-based, and then it is transferred onto electronic medical records. So the nurse working in most health facilities will enter stuff on paper, and then there's a clerk who transfers this thing onto EMRs, medical records, electronic medical records. Now that's quite a process, and it means that there's usually a lag in terms of reporting. Now, for this particular case, we needed to have reporting that was up to date. So between the MOH and the Ministry of ICT, they came up with a new system, Chanjo, and this is what is being piloted and rolled out. And this again is one reason for going a little bit slowly at the beginning. Totally new system. The ICT guys have never really interacted with health. Now, one of our problems with our weak health system is that a lot of our public health is funded by donors. So we've had big scandals in the past, not scandals really, but where we're not in control of our data. And government felt that this was one situation where we needed to have control of our data. And I totally agree with that. So the Chanjo system is one that is protected under the new Data Act, and it is Kenyan, so that we're not exporting our data abroad inadvertently by having a foreigner managing our data system. So it's being deployed step by step. Now, one of the challenges, in fact, I was just in a meeting just before this, is that there is a lag. So far, the reporting is that about 120,000 people have been vaccinated, but out of the depot, over 800,000 doses have been delivered. So there's a huge discrepancy between the doses that are out and the number of people vaccinated. And part of it is because a lot of facilities are not inputting directly into the Chanjo system. They're doing paper first and then having to update later on. And we know what some of these challenges are in terms of the kind of infrastructure that we have. So what is new in this is that number one is that it's the the Chanjo system, the IT system, the data system, and that's what we've had to train for. The second thing is that the reporting around adverse effects. Now, usually what happens up till now, the Pharmacy and Poisons Board has not had a situation where they had to deal with emergency authorization. They've dealt with post-market authorization, where the manufacturer of a drug or their agent will come, this thing has been tested adequately, it's given a license, and then they do the post-market monitoring on all the drugs that we take. Now, this is a situation where we need to keep abreast of any adverse reactions immediately. Now, the immunization program is very good at this, picking up adverse reactions around immunization. Usually the problem, not usually, almost all the cases where there's been an adverse reaction with any of the vaccines that our children get has been around the technique of giving the vaccine and not the vaccine itself. And so the training, the immunization program has been very cautious in terms of the training so that mistakes are not made in terms of giving the vaccine, as opposed, and also the handling of the vaccine as well. So that training has been quite thorough, a little slow, but quite thorough, because we're dealing with a relatively new product, and it has been used over the last few months in the West. But what about in our setup? You know, so handling it from the Kitengela depot all the way to Mandera and so on, all of this has to be monitored, and the feedback has to be as much as possible instantaneous. So those are the new things, the kind of challenges the kind of problems that we've been having to deal with, and it's an ever-evolving situation. So I'm just going to finish in a minute or two, just to talk about, so I've talked about the emergency use authorization, which is something that is new for the country. I've talked about the data system, which is also new. We're hoping that eventually it will roll out to the entire immunization program. I'll just talk a little bit about the vaccination process. Now, we're hoping that by this afternoon, the Ministry of Health will announce that now there is a portal for registration so that people can begin to register, and the distribution of the vaccine can be a little bit more dynamic than a kind of a push system where they're just sending out doses to various facilities. Now, when that comes into place, then I think things will begin to improve in terms of not having these queues and people sort of panicking that you know, the vaccine will run out, or they go somewhere where clearly there's a chance that they could be spreading the disease again. So, Chair, I think I'll pause there and wait for questions. I know there'll be questions around Sputnik and possibly about the vaccine and the process as well. Thank you very much.
Thank you so much, Dr. Aya, for enlightening us from policy perspective. You have noted that three important things that we have to observe, but two are the most critical, is that we must put on our masks. We must ensure there is social distancing. And then if there is availability for vaccination, we go and get vaccinated. But two are within our reach even today. That is having our mask on and ensuring there is social distance. Something else also you have noted is around TOT trainings, which is very critical so that there can be critical mass in our health centers, which is handling the vaccination programs appropriately, or even COVID cases appropriately. Targeted population for vaccination also you have noted, when you are trying to segregate or dissect the population from the one that is vulnerable, the one that is not vulnerable from age of 18 and below, so that the vaccination is well targeted. At this point, I want to invite Madam Phyllis Wakiaga, so that now she can take us through KAM Health and Safety Center. It is your floor, Phyllis.
Thank you very much, Job, and for all the previous speakers. Thank you for very enlightening conversations on different issues. So I quickly want to take us through, because of time, the Health and Safety Center that we have developed as Kenya Association of Manufacturers. And this center has been developed in partnership with the GIZ. I'll just quickly go through what it has. So it's an embedded microsite on the KAM website. And what we are doing on it is that we are providing a quick database of all manufacturing sector companies and businesses under the KAM membership who produce relevant items around health and safety. So this includes the personal protective equipment, the sanitary supplies, pharmaceuticals, and others. So this microsite is supposed to really support the Buy Kenya, Build Kenya agenda and support the strategy of local sourcing and creation of a wider market for locally manufactured goods and services. And currently, these are some of the key products required around the COVID-19 pandemic. We continue to advocate, of course, around the competitiveness and how we can continue to supply a lot of these products manufactured locally. So this health and safety site has been put together with our members. They've been able to give us the different products that they manufacture in the different categories. We are working on finalizing some of the images and photos, but it already has a lot of information on these different products. I think you can see it running on the screen. It has the manufacturers, it has about the center, the manufacturers, the product, the sectors. Before you join, we have a content disclaimer, of course, just confirming that KAM does not take liability for the information. And then within the site, you're then able to see the companies, the contact numbers, and someone is able to search for the product. And there's a form where they can directly fill in and reach out to the manufacturers of the different products. So what we are going to do is we are going to work now with the sectors and the members to continuously update it, because you know our website is as relevant as the information put on it. So we'll also be going on a marketing campaign where we'll be sharing. That's the form I think Danson is projecting, where someone is even able to contact the manufacturer directly through the website. So we've been able to get the contact numbers for the different members who have listed their products. And for anyone who is looking for products, they can contact the manufacturers directly. So this site will be marketed to both our members and third parties. You can see the drop down where we have the product categories, the type, the product name, and you're able then to search for different products. Maybe Danson search a product where people have put in some photos so that people can see maybe the sanitary. I know that's the one a number of members have been able to put in. Yeah, so that's how it will look eventually when all of us upload our products. So what we are going to do, we are keen to include the medical devices, medical equipment and machinery, pharmaceuticals. So we'll be getting in touch with the members directly and also through the sectors. And we urge all of you to please get in touch with us through our members help desk if you're interested to have your products listed within this website. We're also going to embark on a marketing campaign. So we'll be marketing it widely amongst our members and also through our social media platforms. So we encourage you to utilize it. Please get in touch with us so that we can list your products. Thank you very much. And the site is www.safetycenter.kam.co.ke. So you'll see us marketing it quite widely. Asante sana, over to you, Job.
Thank you so much, Phyllis, for taking us through the microsite, which is demonstrating the effort that Kenya Association of Manufacturers is making every day so that it remains connective, or it links those who can supply what is available in the country and those who are in need of it. It's a very integral microsite, and we're encouraging all our members to access that site so that they can upload as many products as possible. We have support team within KAM which will be very handy as far as the execution and implementation of this site is concerned. At this point, we have come to when the participants or the attendees have a chance to ask questions or seek clarification from the presentations that have been done by our esteemed panel. When I look at the Q&A platform, and I'm asking those who are participating still to continue populating the Q&A platform with many questions. The first one is, there is mention of antigen tests for travel to other counties, but no clear information. Please advise and clarify what is this requirement is. This is coming from Milid Majithia, and I would ask Dr. Anastasia to answer this question. There is mention of antigen tests for travel to other counties, but no clear information. Please advise and clarify what this requirement is.
Yeah, thank you. And the aspect of antigen tests for travel to other counties, we have not seen it as private sector as a policy topic, and we will get to hear from the ministry tomorrow. So I think this is not applicable at all. So what we have is inter-county lockdown. We know that. If you need to get out of the counties, then you need to have the essential pass. So anything to do with the antigen test or any other test to move within counties is not something that we're aware of officially.
Thank you so much. Also, from a KAM perspective, we are working on the Form 1 that was issued last year by the government for movement of goods from one county to the other. So this form, though it's dated 2020, we're looking at how it can be upgraded, or it can be dated 2021, and then we can start now getting the Form 1 for our movement. The second question, there's another question here from Godfrey Weluse. In the presentation by KHF, and I think this is Dr. Anastasia who's going to answer again. There was some data that seems to have been copied from the MOH issued situations report. These very detailed report used to be uploaded on the MOH website daily last year until mid-July, after which they stopped being uploaded. If KHF has access to these on a daily basis, would it be possible to upload them on the KHF website for last use too?
Yeah, thank you for that question. Yes, indeed, we are able to receive the daily situation report. Two reports we get. So one is the presser, which is shared within the membership, and the other one is the daily situation report. So we will probably through KAM, then you can distribute it in your channels, because we'll see how it can be done. Maybe we also put it on the KHF website, but also for your members, we'll see how to connect it and put it on some sort of portal. But more important, a sustainable solution will be to ask the MOH to update the report as it comes due, and that is something as KHF we can have that discussion with Dr. Kasera, who is responsible, and see how that can be done, and probably understand why it's no longer being uploaded, but it is shared through email and also through WhatsApp group chat. Thank you.
Thank you, Dr. Terry. Still another question to you. Dr. Nyarita, kindly clarify on the timeline of access to persons below 58 looking at the country as far as the quota public allocation is concerned. When does the delisting of the COVID-19 vaccine for emergency use only drop or self-procure in private sector where this is affordable? Thanks.
All right, maybe I'll also ask for help from Dr. Aya. I know being in the task force, he has as it is, but as far as we know is that, the phase 2, which starts in July this year, is supposed to cater for, for the next phase. But I think the question is asking more like generally everybody. So from what we have seen from the phases, it's July next year. But that's something that, Dr. Aya can provide some more perspective, especially because I know this is, there is new information, new updates coming up every day. In terms of vaccines for emergency use only, when when does the delisting of the COVID-19 vaccines for emergency use only drop for self-procure in private sector where this is affordable? This is until now, the entire clinical trials period and comprehensive data according to the marketing authorization requirements is done. Typically, it takes not less than 2 years. So I think we're getting closer to that. The manufacturers are collecting and collating data. They will submit to their countries, to their home country regulatory authorities. Once the home country regulatory authorities, and these are the stringent regulatory authorities, approve, then also the manufacturers will apply through their local representatives in Kenya for marketing authorization to be provided. And then after that, then it can be a post-marketing sort of surveillance perspective. So it's gonna be maybe a year plus, but we wait to see. So in terms of self-procure in private sector, until we have marketing authorization. So that will depend from manufacturer to manufacturer, from product to product. But I would like, Dr. Aya, if he can provide some more perspective on especially the quota public allocation. Thank you.
Yeah, so we got the first 1 million dose, and then from COVAX, we're expecting another 2 million in April. So unfortunately, the notice tends to be quite short in terms of between being told this is what you expect, because the COVAX mechanism, it's being shared amongst many African countries. So knowing the exact dose and exactly when it comes is something we get fairly short notice. For this first 1 million dose, I think the notice was something like less than 10 days between being told this is your allocation, and by the way, it's landing next Tuesday. So a bit of a scramble, because with the production sites, we're getting our doses from the Serum Institute in India. And I think there's another one either in Korea or Thailand and so on. So it's fairly short notice, but we expect the next lot to come in April. The decision was made that the first million would be given for the first dose. So no holding back on the doses, so that the highest number of people at least get the first dose, which offers something close to 60% protection. The longer it takes between the first and the second dose, the higher the overall level of protection you get in the end. So in a sense, we shouldn't worry too much if there's a delay of a week or so. It's in a sense better for us. The first people who got the first dose should be taking their second dose at the end of April. So that's when we plan to sort of, in quotes, begin to announce the next bit. You realize there's now an overlap between what we are calling phase 1 and phase 2, which is, I think, natural, given the uptake and given that it is a voluntary vaccine. Huh? It's not something that is mandatory like polio and so on. So the two phases will, in a sense, merge depending on availability and also depending on scale up of facilities that are able to offer the vaccine. Thank you.
Thank you, Dr. Aya and Dr. Anastasia. Another question here, Tobias, you can attempt this one, is we have one client who needs to pick his off-grid power system inside the 5-county zone, but he is outside the zone. Is there a way to give a client a one-day pass for the trip? This is from Mikaria.
Yes, for any movement in and out of the roadblocks, you require a pass. So your company needs to fill Form 1 and then issue a letter indicating that the person is working within your companies and needs to move from one zone to another. So you require a pass, you require to fill Form 1, and you require a letter from the company that you're working with.
Thank you. From Rakam, how can KAM help staff who live outside the cessation of travel region into Kiambu or Nairobi to work? Tobias, also you can answer this.
So there are changes coming up on the Public Order Act that is going to be issued, I think, most likely this week or next week, on the Curfew Order 2021. So we've included workers, factory workers as essential, in the essential list of people exempted from the curfew order. So having said that, you are required to issue your staff who are moving from one zone to another with a pass. Their ID, work ID will be recognized, and a letter from the company to show that they are working from the specific company. Without those documents, there will be restriction of movement of the said staff. So I think that clarifies.
Thank you. Thank you, Tobias. Dr. Aya, there's a question about mass vaccination of employees. You can attempt this one. How can I get a team of employees get this Sputnik vaccine, or I generate a vaccination at the same time? Any providers who can come on site? This from Teresa Anyango.
So there's a list continually being updated. The task force had recommended that people should go rather than asking for the vaccinator to come, for two reasons. One is the issue of it's a voluntary vaccine. So people need to volunteer for it. It's not something that you want to coerce somebody to take. So it's people should volunteer and go for the vaccine. The second thing is that in terms of logistics, it is way, way easier if people go for the vaccine. Now, the storage of the vaccine is such that, I mean, the AstraZeneca one, and that's actually also the Sputnik one, can stay out for, I think it's about 6 hours or so, just like other vaccines. And then after that, it requires some refrigeration. So the cold chain mechanism is one that you don't want to interrupt, particularly in the phase that we're in. So as much as possible, we want to be able to control what it is that is happening. So I would advise that should organize to go rather than ask for it to come to me. Thank you.
Maybe I can add, Daktari, that also in the event of any adverse event, you're in a health facility, you can be sufficiently taken care of. So that is another critical aspect that people need to appreciate.
Thank you. That's really, really important, actually. That's really important.
Thank you. I can see Phyllis hand up.
Yes, thank you. I had a question that has been asked to me by one or two people about the vaccine. So people have taken the first dose of AstraZeneca. In the event that maybe the second dose is not available because it has run out, can they take a different vaccine? So can you take two different vaccines, or you only take AstraZeneca, the second must be AstraZeneca, or if it runs out, can you then take a different two doses? So maybe just clarify that for us. Thank you.
Thank you. Probably Dr. I or Dr. Anastasia can clarify.
Okay, so so the speculation about the vaccine running out or the vaccine being changed, it's most likely that we're going to continue with the AstraZeneca. It would be better to start again than to continue, but chances are that this situation will not arise. Like I said, the recommended second dose is between 4 weeks to 12 weeks. So within that period, we expect that we will get the second dose. Thank you.
Thank you, Dr. Aya.
Thanks.
Okay, another question here concerning Form 1 and 2 from Maren. And Tobias, you can answer this one. Do we have the updated forms, and can we say to our members?
Like I said, the updated form will come out with a curfew order. So we have currently been allowed to use the current form that you have. Remember, it is a government document, so we cannot edit it. So use the one that it is. We've been allowed to use it as it is at the moment until the curfew order comes out with an attachment of the required forms to be filled. The other question that I need to respond that is attached to the question, there's someone who says if the technician, I would classify him as a technician coming to repair probably a boiler or a machine in the factory, What they require is a letter either from you as a company indicating that they are coming to repair a machine or a boiler or anything within your family, within your factory. And if possible, issue them with a pass, because we give you extra passes where necessary. If you require a pass, contact us through members help desk at kam.co.ke and we shall facilitate you with a pass. Thank you.
Tobias, also that's one side of the coin. There's another side of the coin, and Mikalia is trying to clarify. But if you have a client who wants to visit your premises, is there a mechanism that has been established for you to facilitate their movement across zones?
Job, I missed you. Did you ask a question?
Yes, Michele is trying to clarify whether there is mechanism that has been established for one to facilitate a client to move from one zone to the other.
The only allowable means to move from one zone to another is, one, if you're moving goods, and two, if you're a factory worker, but you have to fill the required forms. Form 1 has to be filled, and the staff has to have a job ID indicating he's working on a specific factory.
Thank you so much. I can't see any further questions. And we are coming now close to the end of the program. Unless there is any announcement from the board chair from the CEO.
Sorry, Job, Linus Gitahi had raised his hand.
Okay, sorry for that. I've not seen that. Mr. Linus Gitahi, you have a comment. Linus?
Oh, can you hear me now?
Yes, we can hear you now.
No, it's along the same lines as Felix has asked. Now, and I hear loudly the answer by Dr. Aya, but knowing the competition in the world for vaccines, it's a real possibility that, we may not get AstraZeneca in time. We pray that we do. But in the event that we don't, and Dr. Aya's recommendation is that you then take, the full dose of whichever available vaccine, means that in that situation you have two vaccines in the body, 3 doses. Is there any work done to show what is likely to happen to someone if you had, in the eventuality that you have 3 doses of vaccine? 3 doses of 2 different vaccines?
Maybe I can jump in there. Linus, the recommendation is just to take the same vaccine. So you, on AstraZeneca, the second dose must be on AstraZeneca.
So the question though from Felix was, suppose it's not available. We've taken this in good faith that the second dose will be available, but we know the world is competing for vaccines. And there is that small chance that within the 12 weeks that the AstraZeneca will not be available. Then?
Dr. Aya?
Okay, so chances are that if the vaccine is not available, it's not available, full stop. Huh?
Mm.
So realize, so after the first dose, you have very good protection against severe disease.
Right.
Which is what has, so that's the main issue. So that one you almost covered, I think it's like 80–90%. Then the second dose reduces the chances of transmission. So you're not doing too badly with 1 dose. That's what Israel has done so far. They've just done 1 dose. Okay. So to me, the argument about what happens the second dose, it's sort of like, it's a what if, but it's far, far away.
Okay.
I wouldn't be too concerned about it at this particular point, because as we said, whenever we get the second dose, the longer it takes, the better the protection you're going to get.
Okay.
Yeah. So I wouldn't go sort of shopping that, oh, I've got 1 dose, now I want to shop for another one.
even if the other first one is not available.
Even if also, yes, because remember also something which is an issue, and that's why we're talking about this emergency authorization. So far, we do not even know whether this is going to be a lifetime vaccination or an annual vaccination. Remember, the influenza vaccine is an annual vaccination. Yellow fever, polio, measles, and so on are lifetime vaccinations. We don't know what this COVID vaccination is going to be.
Yeah, okay, thank you.
Yeah, so there's still questions to be answered. Thank you.
Asante sana.
Yeah, thank you so much. We are on top of the hour. And from this side, sorry, I had asked whether our board chair or the CEO has any last comment to make before we wind up.
Thank you, Job. I was actually going to ask also Rohin. He was on the call. I don't know if he had any comments or anything to add. He's the chair of the COVID response team.
Thank you, Chair. I think there's no comment. There's a lot of information that has been provided, which we were a little bit unaware about in our daily or weekly meetings that we have. And I think this is good input that we've had. You know, a lot of people have been worried about the first dose, the second dose, availability, whether we should take another vaccine. I think one of the questions that has come about, which we're still not sure, is if you do take the vaccine, can you test positive or not, is a question that has come about. Apart from that, there isn't much. I'm very pleased with this webinar. Thank you.
I don't know who will answer that, Anastasia or Dr. Aya. Would we still test positive after taking the vaccine?
Well, I mean, there are several scenarios. And of course, there are people who have tested positive, after taking the vaccine, not because of the vaccine, but because they were exposed previously by the time they took the vaccine. Of course, if you're, maybe the other question is always that if I have COVID, do I take the vaccine? And the recommendation is that, you can take the vaccine 8 weeks after your last confirmed COVID negative. Don't take it immediately because of, what are they called, antibodies. Now, does the vaccine cause COVID? The answer is no, because it's not an active virus. So that would be my response. But yes, indeed, you could have been exposed before, you could have been exposed after. And remember also, this is protective. You can still get COVID, but the severity of the disease and the fatality aspects are very well taken care of. So we are taking the vaccine to prevent, severity of the disease and eventual fatality that arises as a result of getting the infection. But you're not getting the infection because of the vaccine. No, it is related to exposure.
So a follow-up to that, Anastasia, if you've had COVID, do you need the vaccine?
Yes, you do. And the reason you do, as Daktari said, is that we don't know for how long the protection is, whether you've had the disease itself or whether you've been vaccinated. So you've had COVID, after 8 weeks after recovery, you will need the vaccine until a lot of scientific information is in place to say that this is a one-off protection, in which case when you're suffering COVID, you do not need a vaccine. Remember also, we've seen cases of reinfection with COVID. So this is a scientific information that will be gathered at the evidence that will come out at the end when the products get now final marketing authorization. So we are at that stage that you have COVID, after you tested negative, 8 weeks, you still need to get the vaccine to ensure protection. Thank you.
Maybe just to add on to that, think about it like this. If you have had COVID, it's like your body spotted some coronavirus, but you didn't get enough of it. So the vaccine gives you the optimal dose in order for your immune system to be fully prepared. So you do need it even if you got COVID before. The test that we're doing is a test that picks up on the virus itself. And the vaccine is not the virus. And therefore you shouldn't test positive after after getting the vaccine.
Okay, thank you very much. So I think, just thank everyone who was on the call, and especially our panelists, Dr. Anastasia Nalita and Dr. Richard Aya, for their contribution. I think some good perspectives there. First of all, this is a once in 100 years event. And I think the last time they had this pandemic, it lasted, I don't know, 3-4 years. So it took quite a while to get through. Obviously, technology and communication has increased significantly since. So we hope it's not going to last that long. But let's remember, this is a marathon, not a sprint. There are no quick fixes to this situation. Also very encouraged to hear that at least we are expecting some more COVAX supplies, and there are the private supplies that are in the market as well. So we do hope we can actually achieve more. We have been pressuring government and saying 30% by 2023 is very far. So can we get 30% by the end of 2021 would be great. So then we are getting to the next maybe 20-30% in 2022. So there is a lot of advocacy. We are saying let's accelerate this. Of course, it depends on availability of vaccine and our preparedness, but also our ambition and how much we push for these vaccines. Because like you see other countries, they are getting them by being forthright pushing and going to look for them. So we need to do a little bit of that on our side as well. So for all the members, then finally just stay safe. Let's keep observing the protocols and try and keep this thing down, because it is there is what government can do, and then there is what we must do if we are going to achieve anything in this battle against COVID-19. So thanks very much, Joe.
Thank you so much, Chair, for making the closing remarks. We have come to the end of the program. One thing we're going to encourage is that if you're interested to get the link of the discussion that you have had hearing, you can leave your email under the chat box or the Q&A box. Then the communication team is going to pick the emails and send to you the link. Also, we are going to compile compile a report out of this, which we can share with our esteemed members. So what I'll ask the communication team is that don't hang up the system when the guests are leaving, so that you can be able to pick the emails at the chat box or the Q&A section. We have come to the end of the program, and have a good afternoon.